There was a patient who I was working with here in Pittsburgh, and he told me that probably for the first 4 to 6 months of us working together, he did not trust me at all. When I asked him what changed or what made the difference in him being able to trust me, he said, "You just always show up." And I learned that you were going to keep coming back no matter what. One of the most important things in street medicine is building trust with people. And the main way of building trust with people is to make very few promises, but come through on all of them. Typically, the relationship is built in small chunks over a period of weeks to months. It may be that the first encounter I have with somebody on the street is handing out socks or giving them some water or something like that. It's really important to ask permission to enter into someone's home on the street. Am I allowed to do this? You have the authority to tell me that I'm not allowed. The next thing I do is oftentimes just try to understand kind of where they've come from, what they care about in their lives. If they have a pet, we'll usually start out by talking about their pet. And I share a lot of information about myself as well. We're taught that we're not supposed to tell our patients very much about ourselves because that gets in the way of the focus on the patient and the care that we're providing. It's important for me to offer a different experience for the person sleeping outside and to recognize that psychiatrists have broken their trust or not worked to gain their trust. We're suspending our need to do things on the street, our training with all the tools and tricks and medications that we have to help people. And instead, we're putting that aside and spending time with the person just being with them, because sharing in that load that they carry is maybe more healing than anything I could prescribe or any diagnosis I could make.